Once again, I give you my weekly webcast and answer a few questions that have been emailed or on Twitter or on Facebook to me. So please continue to have the questions coming. And don't forget, the weekly webcast is every week that Congress is in session, which will probably be 3 more weeks yet during June. Then there'll be a week off the week of the 4th of July, and then back into session for another 4 weeks, and then we take a summer break August the 5th through Labor Day. So it's my privilege every time Washington is in session is to answer a few questions, and I'll soon give you an update on what's coming up in the United States Senate this week. Let's go to a Facebook question from Colleen from Coralville. Quote, I believe that the health care bill was passed under the veil of lies, which most of us figured at the time, and by all accounts should be repealed. What do you plan to do? I answer a question, first of all, that what happens in the November election and whether or not there's a big change in the Congress of the United States in November has everything to do with what will be done with the health care bill that passed Congress in March. In other words, I don't see how anything has changed since March that would happen between now and the election. But if there's a big change in Congress after the election, then I would expect some changes to be made. And I would describe those changes this way. Some things in the bill that would probably be policy that Congress would be working on regardless of a 2,700 page bill that we call quote-unquote reform. In other words, a lot of things in that bill are relatively non-controversial and are things that have been floating around, probably would be passed by Congress anyway. And I would say ending discrimination based upon pre-existing conditions, accountable care organizations for emphasis upon cooperation among various health professionals and levels of health care delivery, particularly zeroing in on the chronic diseases like diabetes that eats up 75% of all of our health care dollars. Emphasis upon wellness, emphasis upon preventive medicine, things like doing away with the perverse incentives that are in Medicare to reimburse people, doctors, on quantity instead of quality. We ought to have more emphasis upon quality because that would help us in Iowa because we're very high in quality, very low in costs. Let's say those are just an example of some things that are in the bill that probably nobody would find any fault with. You don't call them Democrat, Republican, or bipartisan. They're just things that people in and out of Congress feel need to be done. Then there's things in the bill that absolutely shouldn't be in the bill, and to give you a short answer, I'll only name one, but there's several things that fall into this category. The constitutional violation that the federal government says you have to buy something for the first time in the 225-year history of the country, and that is the forced purchase of health insurance, enforced by the Internal Revenue Service. That ought to come out. Maybe the courts will declare that unconstitutional anyway. I hope so. Then there are things that aren't in the bill that ought to be in the bill, like medical malpractice reform, so we don't encourage lawsuits that are frivolous. Things like association health plans, so small businesses can have bigger pools for their health care insurance. And then things like selling insurance across state lines so that we have more competition, drive down the cost of health care. So I see it as some things that will be retained, some things that ought to be taken out, and some things that ought to be included. The second question comes from Ronald in Cedar Rapids. Many politicians, including President Obama and former President Clinton, are trying to dispel the anger so many Americans are currently feeling towards the federal government. I was wondering what your thoughts are, and can you blame true Americans for reacting this way? I don't blame Americans for acting this way, because this government is their government, is the people's government. I and my fellow congressmen work for you. You don't work for us. We're in office holding a public trust. This office that I hold belongs to the people of Iowa. It doesn't belong to Chuck Grassley. A public trust is something that you hold for a short period of time, called a term of office. And every once in a while, each of us in Congress, if we don't retire, we have to renew that public trust. And so I think too many people in Congress feel that 535 members of Congress know better than anybody else, and that's why Congress ought to do everything. Whereas I happen to believe, for instance, I deal a lot in tax policy. I believe that we shouldn't have taxes coming into the federal treasury be more than the 18% of the 50-year average of the gross national product coming in taxes for 535 members of Congress, because I believe that we don't know best how to solve every problem, and that leaving the money in the pockets of 137 million taxpayers to decide in 137 million different ways how to do it is better for the economy. The dynamics of our economy will respond to that. People can decide to save, or they can decide to spend, and what to spend on. And I think it creates more jobs if there's more money left in the taxpayers' pockets. But too many people believe we ought to tax everything that moves. This health care reform bill and other taxes, there's been about 38 taxes increased in the last 15 months. If it isn't 38, it's still a lot of tax increases that have been increased. And from that standpoint, that's like saying we know better than you do how to spend your money. So people are angry. People are mostly angry because they feel that Washington has lost touch. And that's something that I hope nobody in Iowa believes I have accepted as a point of view, because otherwise, why in all the years I've been in the United States Senate have I gone to every county every year to hold town meetings? Because if you believe in representative government as I do, you have to have dialogue with your constituents. I'm one half of that process, my constituents the other half, and dialogue is what representative government's all about. I've got to know what Iowans feel through talking to them personally, talking to them on the phone, with reading the mail, and every point of view ought to be considered, and that's how I decide to vote yes or no. But yes, the people have a right to be angry, and I don't think President Clinton and President Obama are able to overcome that anger by the program that they have in place. Thank you for those two questions. This week in the United States Senate, we'll be spending most of the time on a tax bill called the Extenders Bill, and then we'll be working on a few judicial nominations, but not for the Supreme Court at this point. Thank you all very much for participating, and please be with us next week on Ask Chuck webcast.